One of the pets that comes to your hospital has been chosen as the 2025 Arkansas VMA Pet of the Year. And I was like, really? I said, who's that? And she told me, and I said, I know that dog. I said, he comes here all the time. In fact, I consider him one of my friends. And so I'm honored today really to be here to introduce this friend that I have over here. My four-legged friend's name is Mighty Dirk Mouse. And the mouse part is because he was no bigger than a large mouse when he was born. And he was born to a female dog that had a litter of puppies, and they suffered with failure to thrive. She had plenty of milk and wanted to take care of those puppies, but they began to fail and die. And so the decision was made by his breeder, Melissa Freeman, and his veterinarian, Stephanie Inslee, to bottle feed and hand rear those puppies. And back to his name, his middle name comes for his love of a German power forward from the Dallas Mavericks called Dirk Nowitzki. He's an avid basketball watcher. And I think after I finish introducing him to you, you'll be able to figure out why his first name is Mighty. Dirk is a 14-year, 8-month-old golden retriever. He's been a fighter ever since his birth, like I said. And Stephanie Inslee was his veterinarian, and as she began to bottle feed him and rear him, she and her husband, Tim Inslee, decided, I think we're going to keep this dog. I don't think that they realized on that day what they really had done or the impact or the magnitude that this decision would have. Stephanie sitting on her bottom in the floor with her back up next to the cabinets with a baby bottle feeding Dirk. And Dr. Stephanie Inslee, by the way, is a colleague of mine there at the animal hospital that we have. And once he passed puppyhood, really 6 weeks, 8 weeks, shortly after that, he began all the training classes that commonly are done, where they learn how to walk on a leash and sit and stay and learn certain social skills. But further than that, however, Dirk, his education really didn't stop right there, as it became very apparent that he had the desire and the talent and the drive to accomplish so much more. Dirk has pursued a lifetime of continued education, or CE, and I think it's very fitting that he's here today at a CE conference. The past 14 years, Dirk has showed up at our clinic with the mindset that he has a job to do today, that afternoon, and there are people out there that he can help. He is the picture of canine servant leadership. His CE classes and his continual pursuit for learning have really prepared him for a lifetime of service for the people of Arkansas, and the skills that he has impact them greatly every year. Dirk's life work really explains why his first name is Mighty, so let me tell you a little bit about it. Dirk has contributed, as a dog, he has contributed to the furtherance of veterinary medicine. He is one of 3,044 golden retrievers that are enrolled in the Morris Animal Foundation's Golden Retriever Lifetime Study, which was launched in 2012. This is the largest and most comprehensive study ever attempted in veterinary medicine in the United States. His official title is Hero number 33. And the study focuses on and investigates how genetics, environmental factors, lifestyle choices, and how they impact major health outcomes, focusing especially on cancer. Dirk donates multiple tubes of blood every year: urine, feces, hair samples, toenail samples, histopath samples, and his medical records, so that the study can go on, and he does this with nary a complaint. So with this study, he helps us as veterinarians so that we can help others. Also, Dirk is a certified therapy dog with the organization called Pet Partners from 2013 to 2025. This program represents the best that the field of animal-assisted interventions has to offer. Dirk interacts with a wide variety of clients. These would include veterans with PTSD, seniors with Alzheimer's disease, students with literacy challenges, patients in recovery, people with intellectual disabilities, and even those approaching end of life. Dirk believes in the human-animal bond, and he knows his presence benefit humans that are struggling. Dirk, 12 years, he would come to work on Thursday wearing his therapy dog vest or some kind of special outfit for the season, with the understanding he was working that afternoon and had a job to do. If it was Christmas time, he showed up with a Christmas outfit on. If it was 4th of July, there was a patriotic outfit. If it's Halloween, and so on. And he did this not to draw attention to himself, but to make it easier to interact with these people. He's also considered a therapy dog on call. From 2013 to 25, he was a therapy dog on call. Y'all ever been on call? Well, Dirk has been on call. He's on call for family, church members, friends, hospital people, hospice visits, college students preparing for finals, Rotary Club meetings, and other community groups upon request. From 2015 to 25, he was an active and present member of the Therapeutic Animal Intervention Lift Spirits program at Arkansas Children's Hospital. He would show up ready to work and would visit patients and their families who would be waiting on crucial diagnostic treatment, visits, or even infusion patients. These bedside visits that Dirk made allowed these people to better cope with the stress of their medical conditions. 2014 to 2021, Dirk was an active canine member of the Mercy Hospital Therapy Dogs in Rogers. He would visit patients and their families, even those that were in the NICU unit, to spread cheer and sometimes lay quietly while stressed patients would talk to him and pet him. And in this, he helped people find good memories that were lost long ago. 2015 to the end of the COVID travel ban, he was on library duty. He would go to local libraries and he would listen to children read. Sometimes they read in English, sometimes they read in Spanish, but it didn't really matter because he could understand it all. The love and affection he displays has no language barrier. He XNA Airport, National Airport there in Bentonville, as part of the Runway Rovers, where he would go there to the airport and he would visit passengers. He would visit airport personnel to relieve their stress. They would pet him, they would take selfies with him, they would Facebook with him. He would be there to comfort people who were having travel stress. Maybe they lost their bags and they were stressed out. Maybe they've just returned from the worst vacation they've ever had, and he would be there to help them get over that and deal with it. He's been involved in other medical studies other than the Lifetime study. He's been in the Shine On study, phase 3 at the University of Minnesota, that was designed to reduce the mortality and suffering caused by canine hemangiosarcoma. He has contributed to the genetic diversity study at UC Davis. He's contributed to the vitamin D study at the University of Missouri. He's contributed to the lymphoma study at the University of Missouri. And he's contributed to the Dog Aging Project, which explores and understands cognition in older dogs and how to help canines live This is not an exhaustive list, even though it's been long. It's really just the high points. These days, Dirk's mostly retired. He's passed the torch to his younger sister, Letty Sue. His impact on the lives of Arkansans will be felt for generations. And his legacy will be shown in the countless lives that he has touched. He's a bit more fragile these days, as he's recently rebounded or fought back in 2025 from a stage 4 kidney crisis, and now he's in stage 1 or 2. And when I look at Dirk, I can still see the ornery little puppy eyes that he used to have, especially when he turns his head and looks at you. His job in retirement really is to bring hope, bring laughter, and bring love to his little corner of the world. And as I said earlier, he's a beaming example of canine servant leadership. So as this award of Pet of the Year, really it's kind of a lifetime achievement award for Dirk. And it is with that honor and without further delay that I'd like to introduce you to Mighty Dirk and his family, Tim and Stephanie Inslee, as the 2025 Arkansas BMA Pet of the Year. Please welcome him, Mighty Dirk Mouse.
Practice. Dirk's life has been cared for as a fragile puppy all the way through the years that Dr. Parker talked about with the Golden Retriever Lifetime Study and other studies in sample procurement. The nurses take really good care of him, and they've also become quite skilled at esophagostomy tubes and feeding as we made it through the acute renal insult. We call them his aunties, and one of his aunties is here today. His Auntie Carol, well, a couple of them are, but his Auntie Carol has been with him since he was born, and she pointed out the other day that actually goes back to before he was born, because she did the puppy count on the dam when she came in for radiographs before she whelped. All of our doctors have, both those that we have now and Lindy in the past, have collaborated in his care. Early on, Dr. Parker talked about me leaning up against the wall or the cabinets, feeding him a bottle, and I distinctly remember him leaning back in his chair, looking at me and saying, "Dr. Inslee, is that dog ever going to have a normal stool?" And we got there, we got away from it again, and as you can tell, he's very opinionated now. He's in the "I'm old and I get what I want" era. But it's a wonderful place to be. Over his lifetime, we've engaged multiple specialties, specialty colleagues, Mizzou Cardiology Department evaluating his grade 4 heart murmur and his subaortic stenosis diagnosis. That was at 5 months. By 7 months, we onboarded with a dermatopathologist in dermatology, and as you can probably well guess, his milk dandruff turned out to be a severe case of ichthyosis, and we declined the recommendation to put him to sleep and chose instead management, and so glad that we did. We've pulled in ophthalmology, rehabilitation medicine from when he was a young puppy and needed a lot of help to later when he had a lot of cachexia and muscle loss from his illnesses. Oklahoma State University's internal medicine consults with the acute renal injury, radiologists that came in and did ultrasounds for us when he had a severe hepatopathy, and most recently pulling on board independent veterinary nutritionists who can guide us through when you have a dog that doesn't want to eat because things have tasted bad. He was never a good eater. We fought that when he was a puppy, but he was never a good eater. But they've helped us with getting him through the fact that pancreatitis and renal disease fight one another in regards to dietary management. And then again, just the multiple assistants that we've had, and I know that it's been a blessing to me to have all of these people supporting him, to have a couple of his nurses here today. Another one is at the house with Letty Sue, but we call him our miracle mouse. And I think that that is a result of collaboration and a result of having some good dependency on our technical staff and on everybody that, interacts with one another in the clinic, because just like it takes a team with our daily activities just to make a business run, it takes a team when you have a lot of fragile things to take care of. And they allowed me to be a full-time veterinarian and to have him and keep him going. And I thank you for celebrating that special bond that we have, that special bond that he has with all of the people that he's served. Again, he is entering retirement, or has entered retirement, and is quite demanding, and I wouldn't give it up for anything in the face of the earth. So thank you very much.
Tucky.
What an awesome story and an incredible dog.